Alright, here's the review for the superior limb quiz coming up for anatomy. The first group we are going to start with, the group of muscles, is going to be called the scapular sling muscles. A couple things about this. These muscles are all outermost layer body wall muscles that were annexed by a limb muscle. That just means in that the body wall pattern, these muscles are actually within that outermost layer, continuous with that layer, but the limbs, the limb bones, steal them away from the body wall. So these muscles all come from the body wall, and they're the outermost layer. They connect the axial skeleton to appendicular. Okay, so just a couple things about that. Next, we should talk about the actions that these muscles can perform, and these are all pretty much going to act on the scapula. So we're looking at the scapula. We have these actions. If we move the scapula up like this, that's what we call elevation. If we move it down the opposite way, that's called depression. If we move the scapula out, away from the spine, so that arrow is going away from the spine, we call that abduction. And then if we do the opposite, if we take it in this way, we're taking it nearer to that midline towards the spine, and we call that adduction. Okay, a couple more actions that we have here. We can take the scapula, and we're referring to this right here. So that glenoid fossa, glenoid cavity, we're talking about this. If that goes like this, so the glenoid fossa cavity points up, that's what we call upward. Oops. Upward rotation. And then if it goes back down, so after you have the upward rotation, you're also going to be able to do the opposite. Whoops. And that's going to be called the downward. Okay, so there's the actions of the scapula that we need to know. And these scapular sling muscles, so scapular sling muscles are going to do these actions. It's a sling because, again, it's part of that body wall, and it's axial skeleton to appendicular. So these muscles are holding that scapula, which is free floating, except for at that clavicular joint there. It's holding the scapula to the body, so we can act on it. So it's not just flopping around there. Okay, so there's our actions. Now we need to know what the muscles are. So the mnemonic that's usually taught in lab is this. So Roger Rabbit likes to smoke pot sometimes. And then you add a couple numbers. Roger Rabbit likes to smoke pot at 3:45, sometimes at 1. Those numbers will come into play when we're talking about origin and insertion. So these are the muscles, and each of them are going to be named, obviously. So you have the rhomboid major, rhomboid minor, levator scapula, trapezius, serratus anterior, pectoralis minor, and then subclavius. So those muscles are all scapular sling. There is one exception here to what we talked about before, where they're body wall. The one that's not a body wall is actually the trapezius. The trapezius is a head muscle, so it's not really part of that body wall pattern, but all the rest of them can be considered that. So now we'll go down to our picture, this one, and identify them and talk about origin, insertion, function, and the nerve. So we're going to have a big chart after this. So first muscle, first muscle we're going to talk about is the rhomboid. Some people will call it the rhomboideus major. It doesn't really matter. Okay, these are the things we need to know about it. We need to know its origin, insertion, the function, and the nerve. I did blue twice, that's fine. Okay, so the origin, when we're saying the word origin, we're talking about the part or the area where the muscle is attaching one of its attachments that doesn't move. So this is the attachment that is stable. Where the insertion is going to be the bone that moves. So this is the attachment that we are acting on that moves. Okay, so origin is the area where it comes from, insertion is where it's going, and the insertion is what gets acted on. That's where the movement's going to happen. So our rhomboid major, I'm going to do that in orange here, and I'll highlight it like this. So this picture, you can't see it very well. It's poking out right here. And then if you look in all of these little fibers here, it's going to be, since the scapula is kind of right here, like this, the rhomboid major is going to be coming kind of in this area here. Since you won't have to really be coloring, I wouldn't worry about the coloring here, but just so we can kind of see where it is. Okay, so the origin, the non-movable part, this is coming from the spinous processes. So that's our axial skeleton. And then it's specifically of T2 to T5. So each one of those spinous processes, these things we're looking at here, it comes from the thoracic ones, which is actually being covered by the trap, but that's going to be kind of like around this area. So that's where the origin of this muscle is, spinous processes of T2 to T5. This inserts onto the scapula. So if I kind of we just imagine where that scapula is, it's going to be kind of like that superior angle here. This is inserting onto the medial border of that scapula, but it's below the level of that spine of the scapula. So here's the spine of the scapula. That's inserting below it. So medial border of the scapula, below spine. There's your insertion. Okay, so now that we know the origin and insertion of that muscle, we should be able to figure out its actions. So this one has two actions. Since the fibers are going to be pulling in like this towards the non-movable portion, that's going to be adduction, and we're acting on the scapula, so adduction of the scap. And there's another one, since they're also pulling up like this, that's going to cause a rotation of that scapula. So if we pull it in like that, what kind of rotation is that going to be? That's going to be a downward rotation. And you always have to put what you're acting on. So downward rotation of the scapula. This is more going to be like if your scapula is upward rotated and then you're going back. These can assist with, sorry, lost my mic. These can assist with bringing that scapula back down, downward rotation, more into the neutral position. Okay, so the rhomboid major. Now we need to talk about the nerve. The nerve is called the dorsal scapular nerve. Okay, there's the information we need to know on that muscle. Now we can move on to the next one. So if we have a major, we also have a minor. And again, we're going to know the origin, insertion, function, and the nerve of this. So the minor is actually just superior to the major. If I was to try and guess where it is in here, probably around here somewhere. But again, I don't think it matters too much that you know how to do this coloring. Probably up here. Okay, so the insertion and origin of this, since it's right above the rhomboid major, the origin has to be higher than T2. So this origin is actually the spinous processes of C7 and T1. So that's just two spinous processes. C7 is the big bump you can feel on the back, kind of at the base of your neck, and then T1 is just right below that. So C7 and T1, that's our origin. Its insertion is also the medial border of the scapula, but this is at the spine. So the major was below it, kind of like down here. The minor inserts right there at the level of that spine of the scapula. Okay, its function, this doesn't really have much of a rotation ability, but it definitely pulls the muscle in towards the midline, so we call that adduction of the scapula. And its nerve also is the dorsal scapular nerve. Cool. Okay, third muscle that we're going to talk about here is the levator scapulae. Okay, levator scapula. Nice thing about this one is the name tells you what it does to the scapula. So levator scapulae just means elevates the scapula. This muscle you can see right here. And then on this side, it's a little bit smaller. It's just maybe right there. Okay, so its origin, this is actually coming down from the neck. So you can see there's an origin right here, and you can see it's headed up towards that neck this way. The origin of this is actually the transverse processes of C1 to C4. So those first four cervical vertebrae, the transverse processes is where this muscle is originating from. So again, we're not really moving those cervical vertebrae. It inserts onto the scapula, and you can kind of see right here. That's that landmark we know is the superior angle. Okay, the name of the muscle tells us where it is, and it makes sense with our origin insertion that it's going to elevate and its nerve is also the dorsal scapular nerve. So the dorsal scapular nerve innervated 3 muscles. These 3 right here. Okay, now we are going to the next one. And this muscle is called the trapezius. So that trapezius was that exception. It's actually a head muscle. If we look at the picture here, we can see it's coming from the head and it goes all the way down to the thorax. Just this big sheet. It swings around here. And then on this side, it's going to be coming around like this. Attaches to the clavicle and the scapula. Okay, so there's our trapezius. We're going to go through this again. Origin, insertion, function, nerve. Okay, the origin of the trapezius has 2 different origins. So if we look at this, this is that occipital bone. So one of its origins is the occipital bone. And there's a specific name for the area where it's coming off of. It's the superior nuchal line or external occipital protuberance. But just remember, it's coming from that occipital bone. You don't need to know the exact details. Just if you see something external occipital protuberance or superior nuchal line, that's all referring to the occipital bone of the head. And then as it comes down here, it gets kind of tendinous. It becomes this tendon here called the nuchal ligament. And we just kind of skip over that. So the occipital bone, and then it also goes from spinous processes of C7 to T12. So again, kind of right in this area, and then it goes down to T12. Really, the muscle attaches to all the spinous processes, but there's a bunch of muscles that do that there, so we kind of just skip over that area where it becomes the nuchal ligament. Its insertion, there's 3 insertions. So the first one we can see is right here along that whole spine of the scapula. So spine of the scapula, and then it also wraps around this landmark called the acromion. I don't know if that's with an O or an A. And then on this anterior view, you can kind of see the muscle is over here on this lateral third of the clavicle. Oops. The lateral third of the clavicle. So basically, if you make like a C shape with your hand, and you kind of cup your shoulder around where your deltoid is, like put your hand on your deltoid, your fingers should be making a C shape around or where that trapezius is inserting. So like if my hand is a C like this, and I take that C and kind of do it like this. Hopefully that makes sense. If not, at least you have the landmarks here. So the function of this, we can see it's coming from the head and it attaches to that upper part of that scapula, those landmarks. So this is an upward rotator of the scapula. It's going to pull like this. So that's going to cause it to go up like that. And then it has these fibers which are kind of medial. So, or sorry, yeah, they're moving more medial. These are going to adduct the scapula as well. Cool. The nerve that innervates this is the accessory This is the accessory nerve. It's actually cranial nerve 11. So a cranial nerve that comes from the brainstem innervates this muscle. So that's kind of why this is considered a head muscle. It's not innervated by a typical ventral ramus. Okay, there's that muscle. Next one we're going to talk about is serratus anterior. Okay, serratus anterior. So we had the serratus posterior superior, serratus posterior inferior. Now we have the serratus anterior. Remember, the serratus posterior, those muscles were the outermost layer of the body wall. Serratus anterior is just continuation of those, but it gets annexed by the upper limb bones. So to draw this in, you can see it's kind of here. It creates that serrated saw look, and it's going to wrap around the back. I'm not going to try and draw those, but then we can see it on this posterior view here. So it's a pretty big muscle. It's hard to tell where it's originating from on this picture and where it's inserting because there's so many different muscles covering it. But once we talk about it, it should make sense. I already had a... Okay. So origin, insertion, function, nerve. Okay. So the origin, again, is the axial skeleton, which on this picture is our ribs. So this originates on the anterior... Just kidding, not anterior. The lateral surface of ribs 1 through 9. So from your first rib all the way up here, 2, 3, 4, 5, 6, 7, 8, 9. That's the lateral surface of ribs 1 through 9. And you could also call it the anterolateral, which just means this is more anterior and it's lateral. So the more anterior lateral surface of ribs 1 through 9. It originates on the it inserts on the scapula, and it's the medial border, except it's the anterior surface of the medial border. So looking at this, this is the posterior view, and if I were to take this is the posterior surface of the medial border. But this is actually on the inside. So just on the anterior surface, you can kind of see, here's the outline of that scapula. That muscle kind of wraps around and inserts like this. So it's on the anterior surface of that medial border of the scapula. So since this comes from the anterior surface and wraps around to the scapula, when this contracts, it's going to pull the scapula away from the spine. So it's going to pull away like this, or like this. And it's going to cause the scapula to kind of wrap around. So just think about when you punch, if you do a punch across your body, that's going to be abducting your scapula. So this is a big abductor of the scapula. This is the boxer's muscle. People that box have these pretty defined, especially these anterior serrated saw-looking muscles. So abduction of the scapula. This can also do some upward rotation. Probably not a big deal though. The nerve that innervates this is called the long thoracic. The long thoracic nerve innervates this. That's the only muscle that nerve innervates, long thoracic. And when we go over brachial plexus, we'll reconnect all this stuff together. Okay, now let's go to the sixth muscle we have is called the pectoralis minor. Okay, pectoralis minor, origin, insertion, function, nerve. Okay, we look at this picture. The pec minor is this one. that has these three little origins here. And that's when we were talking about the mnemonic, we're talking. Sorry, I accidentally canceled the recording. We're talking about the pectoralis minor, and we were talking about this muscle, this pot at 345. The 345 kind of gives you a reminder of what its origin is. So we can see here's rib 1, 2, 3, 4, 5. So this originates on the anterior end of ribs 3, 4, and 5. Because here's where the ribs end, and then it turns into costal cartilage here. So the anterior end of ribs 3, 4, and 5. And it inserts, we can see where it's inserting onto this landmark of the scapula. That's that coracoid process. So since this muscle is more anterior, this can kind of pull that scapula out and assist with some abduction. And then I believe it also assists with downward rotation. The nerve that innervates this, there's actually two nerves that innervates this. You have a lateral and medial pectoral nerve. So that's that pec minor. Okay, and then our final muscle we're going to be talking about is this guy right here. It's right under the clavicle bone, and it's named subclavius. So subclavius. It originates, if we go back to the mnemonic, sometimes that's referring to that subclavius, sometimes at 1. So there's the rib 1 where that circle is. That's the anterior end of rib 1. It inserts on the inferior surface of the clavicle. Its function, technically, if you just put stabilizes the clavicle, downward rotates clavicle, which who knows what that looks like. Downward rotation of the clavicle would also affect the scapula, so that's why that's there. And the nerve is called the nerve to the subclavius muscle. So nerve to subclavius. Okay, so there's our scapular sling muscles, all the origin, insertion, function, and nerve. There's the picture that you might see on the exam, and there's the actions of the scapula. All right, so the next group of muscles we're going to be talking about are the rotator cuff. So our rotator cuff muscles. These muscles, a couple of things about them. They come from the scapula and they attach to the humerus. So these are true limb muscles now. Unlike those scap sling muscles we just talked about, which came from axial skeleton to the scapula, this is going from a limb bone to another limb bone. There's 4 of them, and the mnemonic the TAs like to teach are these are the sits muscles, SITS. And as we go through that, we'll talk about how that makes sense and why it's helpful. This is a pretty simple group because they insert into the same place. 3 of them insert into the same place, and then one more inserts just into the opposite. So number 1, we're looking at number 1 here. This muscle, we can just describe what we're seeing with this picture. Its origin, again, what are we trying to act on? We're trying to act on the humerus here. So its origin is right here, and that's what we call that supraspinous fossa. So number 1, we should name it first, is called the supraspinatus. Supra meaning above, spinatus referring to that spine of the scapula. It originates in the supraspinous fossa. It inserts, if we look over here where it's inserting into, there's this tubercle in this area. We call it that greater tubercle. So it inserts onto the greater tubercle. Function and nerve. So the function of this is, since it's on the very top of the scapula and it's basically just pulling like this, it's going to pull that humerus, and the humerus is going to swing like this away from the midline, which is over here, and that's what we call abduction. So abduction of the humerus, or you can also call this shoulder abduction, because the joint between the humerus and the scapula, that glenoid, this is the shoulder joint. So we're acting on that actual shoulder joint by pulling on the humerus. So this is abduction of the humerus, but it's only the first 15 to 20 degrees. So this initiates that abduction, or taking your humerus away and kind of making a T shape. If you do both of your arms, kind of a T shape with your body. So that's shoulder abduction. The nerve that innervates this is called the suprascapular. So there's our supraspinatus, that number 1. Number 2, you should be able just to kind of logic your way through the names of this one, or this one. It's below that spine. It's the infraspinatus. It originates in the infraspinous fossa. It inserts right there, which is also known as the greater tubercle. It's a little more complicated than that, but it's not a huge deal. You know the exact details. It goes to that greater tubercle area. So that's the important thing here. Its function, so this is not on the top, so it cannot cause that humerus to like go out of the body or away from the body. This one is more going to be pulling like this, which is going to cause the humerus to rotate like this. So if this is anterior, it's going to rotate like this. So if you take your thumbs, sorry, I keep canceling it. If you take your thumbs and put them by the sides of your body, and you do like a thumbs up, and then you point your thumbs away from your midline. That's the action this muscle is going to do of the humerus, and that's called lateral rotation or outward rotation. So it laterally rotates the humerus, or outwardly rotates the humerus. And again, you can say shoulder here if you want to. Lateral rotation of the humerus. And then the nerve is also that suprascapular. Okay, so that's the infraspinatus, which laterally rotates. So just think, if you, the best thing to do is just point your thumbs straight up and then point them away from each other. So your thumbs are pointing in opposite directions. That's what lateral rotation of the humerus is going to look like. Okay. Number 3 This number 3 is a little muscle right down here. This is called the teres minor. So the word teres just means round. So this is a little round muscle. There is a major, but is not part of this rotator cuff group. Sorry, I have allergies. That's why I sound the way I sound. Okay, so origin is the non-movable part. We can see it's coming from that scapula. That's like the lateral border of the scapula, so that's what we're going to say. Okay, its insertion, again, we just simplify it and we say greater tubercle. Okay, its function is the exact same as the infraspinatus. It's that lateral. When I said outward rotation, I meant external rotation. So lateral rotation is the same thing as external rotation. And then the opposite of external would be internal rotation. So that would be like having your thumbs by your sides, by your hips, and then pointing your thumbs towards each other. That's internal rotation, or medial rotation, same thing. And then if you just do the opposite and point your thumbs away from each other, that's lateral rotation or external rotation. The nerve that innervates this is kind of out of context here. But we have this nerve called the axillary nerve. And that also innervates the deltoid, but we will come back and talk about that. Okay, so you can see number 1, number 2, number 3, they all sit on the greater tubercle. And sit happens to spell supraspinatus, infraspinatus, teres minor. So they all sit on the greater tubercle. Number 4. So number 4 is actually on the opposite side of the scapula. This is all on the posterior. Number 4 is on this anterior surface over here. That is called the subscapular fossa. And the muscle is called the subscapularis. Okay, so subscapularis. It originates in the subscapular fossa. It actually goes to this tubercle, which is also called the lesser tubercle. Okay, the function is, since it's exactly opposite of 2 and 3, these ones externally rotated or laterally rotated, this one is going to cause that humerus to medially rotate or internally rotate. And the nerve that innervates this, there's two. There's the upper and the lower subscapular. So 2 nerves there, upper and lower subscapular. So there's your rotator cuff, the sits muscles. If we add the little s, number 4 is that little s. That's because it goes to the lesser tubercle. And that's where the sits mnemonic comes into play, this one here. So there's your rotator cuff. All right, next couple group of muscles we're going to be talking about here. The first one is going to be the deltoid. And the deltoid is in this group that is called the shoulder cap. The only muscle in the shoulder cap group is the deltoid. So The deltoid comes from scapula and clavicle and goes over to the humerus. So again, we're just acting on that shoulder joint. So the muscle in these two pictures, that's just the deltoid. You can see the deltoid has 3 parts to it. You don't need to worry about the 3 parts, but there's 3 actions to the deltoid due to these 3 different segments. So we have the deltoid, origin, insertion, function, nerve. So it originates on the area that's not moving, which is going to be the clavicle and the scapula. Its origin is the spine of the scapula, the acromion, I'll try it with an L this time, and then the lateral third of the clavicle. This should sound familiar because we have said these exact landmarks before. You should make sure you can remember which muscle shares this attachment. So again, there's another muscle that shares these 3 attachments. You definitely probably should know what muscle shares those attachments. It's not necessarily the origin, but make sure you can remember that. This muscle inserts onto a part of the humerus called the deltoid tuberosity. If we go up to this picture here, you can see the deltoid tuberosity is kind of over here, and that muscle just inserts there. It's on the kind of lateral anterior part of the humerus. You can see over here as well. Its function, since there's 3 parts to it, can do 3 things. It flexes the shoulder, or flexes the humerus, which just means you lift your hands straight in front of yourself. So flexion is when you take right here and you go like this, straight in front of yourself. So then your hand would be kind of like out here. Your hand would be right in front of you. It's like you're lifting your hand up for a high five, sort of. So that's flexion of the shoulder. It also does abduction of shoulder, which if we use this picture, that's going to mean the shoulder, the humerus goes out like that from the body. So like if you're making a T shape with your arms. And then the last one, since it's also in this posterior area, it's going to take the humerus and do it back this way, which is called extension. And that's just the opposite of flexion. So extension of the shoulder. The nerve that innervates this is the axillary. And if you can remember, the axillary nerve also innervates that teres minor muscle. So there's the deltoid and the information we need to know about that. The next group we like to call it the intertubercular groove. The intertubercular groove group, or shortened is the ITG. So the ITG group. A way to remember this, the muscles that are in this group, there's this saying, 2 majors and a miss. It can be helpful if you need some kind of memorization tool. Basically, there's 2 muscles that have the word major in them, pec major and teres major. And then there's this number 1, which is called latissimus dorsi. That just has a miss in its name. So 2 majors and a miss. Maybe it works for you. Okay, so let's talk about these. Here's number 1. This one is called the latissimus dorsi. Dorsi just is referring to posterior dorsal. Origin, insertion, function, nerve. So these ones are attaching, well, this latissimus attaches to the axial skeleton, but this muscle actually grew in the limb. It began over here and then grew itself back like this. So it's not one of those outermost muscles. This actually sits on top of those. It's not part of the body wall. This is a secondary regrowth from the limb onto the trunk. Okay, so latissimus dorsi, its origin is here and goes down to here. So we say spinous processes, spinous processes of T7 all the way to the sacrum. So from T7 all the way down to the sacrum. It inserts into the intertubercular groove, ITG for short. So it's coming from down here and it goes all the way up, and here's that intertubercular groove, which is on the more anterior portion of the humerus. So this is not, you can see it's kind of faded here. This is going to the anterior portion of the humerus, where the ITG is. So it kind of wraps around from posterior to anterior. Its functions are medial rotation of the humerus or the shoulder. Okay, so it medially rotates. This is like taking your thumbs on your sides and then really rolling them inwards. So pointing them to each other and then continuing, kind of like making a thumbs down on the gladiator, just a big thumbs down. So medial rotation of the humerus, and this will also do extension of the humerus because it's coming from posterior. It's extension of the humerus, especially if that humerus is flexed. So think about doing a pull-up. Your shoulders are flexed, and then when you do a pull-up, you're extending those shoulders back. So extension of the humerus. The nerve that innervates this is called the thoracodorsal nerve. So there's your latissimus dorsi. Second muscle, if we look up here, here's that second muscle. This is called the teres major. The teres minor was right up here, and the major is below the minor here again. So this is the teres major. Its origin is on the scapula. That's the inferior angle, and it's the posterior surface of that inferior angle. Okay, it inserts onto the intertubercular groove because all of these muscles that we are talking about here do. It's on the back. So it's going to assist with extension. And another thing it does, it also medially rotates humerus or the shoulder. So medial rotation of the humerus or internal rotation, same thing. So you can see there's a kind of a pattern developing here. The latissimus medially rotated, the teres major medially rotated, and the pec major, which we're going to look at next, also does. The teres major is innervated by the lower subscapular nerve. So that's kind of a weird one. The lower subscapular innervates the subscapularis and the teres major. Just kind of a weird variation there. Third muscle is the pectoralis major, right here. The pec minor is kind of sitting right under it, like that. And if you remember, the pec minor was a body wall muscle. The pec major is a limb muscle. There's a little pocket under that pec major where breast implants can fit. So there's a fascial cleft in here where you can take a breast implant and stick it between the minor and the major, and there's a little pocket there where that can sit. And it kind of causes the muscle to push out, which gives that fuller look. But here's number 3, pec major. So its origin, if we look at it, it's attached to that lateral surface of the sternum, and it's the anterior surface. So we're going to say the anterolateral surface of the sternum, and it's also the medial half of the clavicle. So here's the clavicle, here's the medial half of it, here's the more lateral half. Okay, this inserts over onto the intertubercular groove, ITG for short. Its function, it's going to be medial rotation of the humerus. And this one also flexes the shoulder, especially when it's extended. So think about when you do push-ups, your shoulders are pretty extended, and then you push and you're flexing the shoulder. So the pec definitely helps with that. And then the nerve is the lateral and the medial pectoral. If you Google this, you might not see lateral and medial pectoral innervating that. There's some variation there, but just for this class, lateral medial pectoral innervates both the pec major and the pec minor. Okay, so there's your shoulder cap muscle, the deltoid, and then your intertubercular groove muscle. All right, last group of muscles we're going to talk about where we have to worry about origin insertion are the brachial muscles. So we have 2 compartments in your brachium. You have the anterior compartment and you have the posterior compartment. This image here is the anterior brachium, and there's going to be 3 muscles. This picture here is the posterior brachium, and there's only 1 muscle there. Okay, so the anterior brachium is what we will start with first. There's 3 muscles. First one we're going to talk about is called the biceps brachii. And you want to make sure you're specific biceps brachii because there's also a biceps down in the leg or the thigh. So you need to specify if you're talking about the brachii or the other one. So origin, insertion, function, and nerve. If we look at this, we're talking about number 1. So the biceps, bi means 2, sep means heads. So the bicep has 2 heads. The long head originates from this tubercle over here, which is above that glenoid cavity. So we call it the supraglenoid tubercle. And then you have the short head. You can see the short head is coming from that coracoid process. Okay, so long head, supraglenoid tubercle, short head, coracoid process. The important thing to remember about these muscles is how many joints they cross. So far, most of them have only crossed 1 joint, but the bicep crosses this joint here, the shoulder, and then it also crosses this joint called the elbow joint. So that muscle can act on 2 joints. Its insertion, it comes down and it inserts onto this tuberosity on the radius. That's called that radial tuberosity. Okay, so now its functions. It's crossing the shoulder and it's anterior, so this can flex the shoulder. it's not the main flexor of the shoulder, it just is going to assist, but it flexes the shoulder, flexes the elbow because it's crossing anteriorly. And then it also does something called supination. So supination is like if you put your hands in front of you and you flex your elbow, and then you look at the back of your hand, and then you turn your hand around and make like a bowl with your hand. So it's like now you have two bowls and your palms are facing up like you have a bowl of soup. The action of turning your hands over so you can see your palms is called supination. And then the opposite, if you take your palms and point them down, is pronation. So you have a bowl of soup, supination, you pour it out, pronation. So the bicep does that as well. The nerve that innervates this is called the musculocutaneous. So musculocutaneous nerve. Okay, there's your bicep. Number 2, we can see this number 2, here's the whole outline of it. This is just kind of showing the simplification of the muscles if you didn't catch that. But number 2, we call this the brachialis. This only spans across the elbow joint, so it does not cross the shoulder. Okay, to describe this origination, you can just say the anterior distal humerus. Anterior distal humerus, and you can see it's crossing. Here's the ulna, here's a tuberosity on the ulna, so it inserts onto the ulnar tuberosity. So the radius is the one that can allow for supination and pronation. The ulna, its only real function, since there's a hinge joint between the humerus and that olecranon, it can only flex. This muscle can only flex because there's no other real movements of the ulna other than that flexion. And the nerve is also the musculocutaneous. And then the third muscle, we can't see it on here, but if I were to draw it in, it comes from the coracoid process here, and it's just going to be a really short little muscle like this. It only crosses over the shoulder joint. It does not cross the rest. This muscle, so number 3, this is what we call the coracobrachialis. So from the coracoid process to the brachial bone, coracobrachialis. Its origin is the coracoid process. It inserts onto the mid-medial humerus. So this is like the middle, we could pretend. So it's inserting onto that mid-medial humerus. Its function is flexion of the elbow. Not the elbow, sorry, the shoulder, because it does not cross the elbow. Its nerve is also the musculocutaneous. So the anterior compartment, this anterior brachium, the nerve is that musculocutaneous. So if you happen to injure that nerve, you're going to have some issues flexing that elbow for sure, because these are really the only muscles that do that. Okay, then we go to our posterior brachium. Ignore this one here. But we're looking at this number 1, which I'm going to call number 4. This is the triceps. So this is the only muscle in our posterior brachium, but it has 3 heads to it. So tricep, 3 head. So origin, there's going to be 3. You can see there's a long head, which is more medial. It's attaching to the scapula. Then you have the lateral head, which attaches to the humerus, and then this medial head, which is inferior on the humerus. So if you can remember the long head of the bicep attached to the supraglenoid tubercle, the long head of the tricep attaches to the infraglenoid tubercle. So long head of the bicep went to the supraglenoid. Long head of the tricep goes to the infraglenoid. Then we have the lateral head, which you can just say the upper posterior humerus. Then you have the medial head, which is the distal posterior humerus. So you can see that, and you can see that. All three of those muscle bellies come together to create the tendon of the triceps, and that inserts onto the olecranon. So the insertion is the olecranon, and that's on the back of your brachium. That's your elbow, like the elbow too pointy area. So olecranon. The only function that can happen there if we're attaching to the ulna is extension of the elbow. But we also have to remember some of this crossed the shoulder joint, and it's on the opposite side. It's on the posterior, so it can also do extension of the shoulder. It's not the main extender of the shoulder, but it does assist because it crosses. And the nerve for this is the nerve called the radial nerve. So there's your anterior brachial muscles and your posterior brachial muscle, and origin, insertion, function, and nerve for those. And those are the last origin and insertion you need to know. The rest of them, as we head into the antebrachium, you just kind of need to know the names and their functions. All right, next group of muscles we are going to talk about is the anterior antebrachium, which is what we are looking at here. The nice thing about these is we do not need to know their origin and insertion, just kind of more generalized, and the names tell us what they do pretty much. So we're going to go through the muscles that we have here. Okay, I'm going to start with these 5 here first. So these 5 are called the superficial group, meaning if you dissect off the skin, they're going to be right kind of under that skin. And then there's other ones that are deeper to these actual muscle bellies. So there's kind of like 2 layers in the anterior antebrachium of muscles. So this first muscle we're going to talk about is called the pronator teres, and it's this little short one here. This originates on this landmark here, which is that medial epicondyle of the humerus, and it only crosses the elbow joint. So it starts at that medial epicondyle and goes over and attaches to the radius over there. This is called the pronator teres. Okay, and the name tells you what it does. It pronates. So that's its function. The nerve supply to this is a nerve called the median nerve. So the median nerve is going to innervate most of these muscles we talk about. So the median nerve is really the big nerve of the anterior antebrachium. So there's the function, there's the nerve. Again, we don't need origin and insertion, but I'm going to put a star next to this because it does originate on that medial epicondyle. And that's a test question usually. What are the muscles that originate on that? Okay, the next one we have, it starts with an F. Anytime you see a muscle that starts with an F and it's anterior, that's pretty much going to be a flexor. So this muscle that we're going to talk about here is called the flexor, and it's right here. This is the flexor carpi radialis. So it comes from the medial epicondyle, which would be where the screen continues up. There's a little sliver of it there. And it's going to end just right here on one of those carpal bones, more on the radial side. So that's the flexor carpi radialis. So flexor, because it flexes. Carpi, that word means wrist, so it flexes the wrist, and it's on that radial side. Okay, the nerve here is the median nerve, and this has a couple different functions. So it's going to flex the wrist, and it also does this thing called radial deviation. So if we were looking at this image here, radial deviation would mean like you don't move anything but the wrist, and the hand goes over like that. So it's kind of like a side-to-side movement of your hands. Hopefully that makes sense. I'll try and insert images of all these movements at the end, but radial deviation is another action of that flexor carpi radialis. Next muscle we're going to talk about starts here, and then it turns into a tendon, and then the tendon stops right there. This muscle is called the palmaris longus. Not everybody has this muscle. It's a muscle that humans are losing just because there's not a ton of function for it. So it's a variable in people. But you can see it crosses the wrist, so its function is going to be flex the wrist, and its nerve is going to also be the median nerve. So the median nerve innervates a lot of meat. So median, meat, kind of sounds similar. Innervating lots of stuff. Next muscle we have starts with an F, and it is over here. This one also just ends in the wrist. It starts with an F, so it's a flexor, and it ends on the wrist on the ulnar side. So we call this flexor carpi ulnaris. Okay, the function, it's the same. Flexes the wrist, and then it ulnar deviates to the ulnar side. So ulnar deviation. So this is like you're in anatomical position. The wrist is going to bend like this. Ulnar deviation. This way is radial deviation. So it's kind of like waving your hands back and forth. Okay, I'm going to move this a little bit. The nerve that innervates this is a different. This is the ulnar nerve. So just remember, flexor carpi ulnaris is innervated by the ulnar nerve. Next muscle we're going to talk about also starts with an F. This one is kind of like its own intermediate layer. So we have the PF and the PF, the pronator, the two flexors, and the palmaris longus. Those are very superficial. Then we have this one that's kind of sandwiched in between these two layers, the superficial and deep layer. But I will draw the extent of it on here. There's a little bit of it over here, I think. The key thing for this is you want to be able to follow the tendons and see where they're going. So this tendon is coming out right here, and you can see how these tendons split. So any of these tendons that are coming to the fingers and they split, that is this muscle called the flexor digitorum superficialis. And it only goes to the digits, not the thumb. And there's some more of it here, but there's a bunch of tendons in here. Again, I don't think you'll have to color, so I wouldn't worry too much about coloring of the tendons. Okay. Flexor digitorum, superficialis. This flexes the wrist because it crosses the wrist. It's also going to flex the digits. So flex digits 2 through 5. I don't know why I spaced on that. Basically all of them except the thumb. And then it also, so the detail with this is you have these different joints of the fingers. So if I drew, this is a metacarpal bone, and then you have your first phalange. This is called the proximal phalange. Then you have this middle, and then you have this distal. So that right there is one finger. The superficialis goes like this. It ends at this joint. So it can act on these two joints, really. So it flexes the digits at what we call the metacarpal So it's the MCP joint, which stands for the metacarpal phalangeal joint, which is this one here. And then it also will flex at the proximal interphalangeal joint. So proximal interphalangeal joint, which is right here. So the superficialis doesn't act on that distal interphalangeal joint. Sometimes you'll hear these, so you have the MCP and then you have the PIP for proximal interphalangeal joint. That's what that refers to. Okay. So there's your superficialis. So mnemonic for this, these 5 superficial, they all originate on that medial epicondyle. So your medial epicondyle there's 5 of them. So there's a mnemonic, there's a clean and dirty one. The clean one is you just say pizza, fries, pizza, fries, fries. So, I mean, just remember that saying. There's also one that is pimps, and then F-bomb, and then prostitutes for fun. So it's up to you which one, if you need a memory device to remember these 5 that are on the medial epicondyle. So after the 5, there's 3 more. So we have 5 superficial, and then we have 3 deeper ones. These deeper ones, you have an F, another F, and then a P. So the first F we're going to talk about, let's see, I'll do it in this green. This one goes to the thumb. We can see its tendon right here. And then the rest of it's over here, like that. So it's an F, so it's going to be a flexor. And it goes to the thumb. The word for thumb is pollicis. And this is long. And there's also a shorter one actually in the hand, which is over here. The shorter muscle is over here. So you have to add the word longus. So flexor, pollicis, longus. That's because it's long coming from the antebrachium and going to the finger. Where there's a shorter one, which we're going to call a brevis, which means short, that's actually just in the hand. It does not come from the antebrachium at all. So flexor, pollicis, longus, it flexes the thumb. and it's innervated by median nerve. The nerve for this flexor digitorum was also median, sorry. Okay, now we have another F. And this muscle, let's see, I'll do it here. This muscle's kind of in this area. So it's deeper, it's being covered by the rest of those muscles we've talked about. This one goes to the digits as well, but you can see some of the tendons, these ones, go through that split. So the superficialis splits like that. And then this light purple that I'm drawing is the muscle we're talking about. This is called the flexor digitorum profundus, which just means the deep flexor digitorum. This is going to flex the wrist as well as all the joints of the fingers. So that means that comes up like this. It flexes the MCP, the metacarpal phalangeal joint, the proximal interphalangeal joint, and then this one is called the distal interphalangeal joint. This is the proximal interphalangeal joint. So that one flexes all of them. So profundus pierces through the superficialis split. This one has a weird innervation as well. So the nerve for this, half of it is the ulnar and half of it is the median. So it's kind of a weird innervation there. Two nerves innervate the one muscle. And then finally we get this last muscle. It starts with a P, and it's this one just down here. It does not cross the wrist, just stays in the antebrachium. We call this the pronator quadratus. So four-sided muscle that pronates. Its function is it pronates, and the nerve for it is the median nerve. So there's your 8 muscles of the anterior antebrachium. And I've pretty much colored them all in here. So we have all these other muscles over here that are not part of the anterior, but you can see them from this view. So just remember, there's 5 that come from the medial epicondyle, which are these top ones up here with the stars, these ones up here, and then there's these 3 deeper ones. Okay, now we're going to move to the posterior view. So we're looking at the posterior. Here's the elbow olecranon. So that's kind of how I would know we're looking at the posterior view. There are 12 muscles here. Okay, so there's 12. Nice thing about this is the nerve is the radial nerve. So the nerve that's called the radial nerve innervates all of those. So that's the one nerve for 12 muscles. The best way to go through these and break them down so they're memorable is you take 3 muscles and you create 4 groups. So we're going to have a group of muscles that work on the fingers. So we're going to have 3. We're going to have a group of muscles that work on the thumb. 3 more. We're going to have 3 that work on the wrist, or that move the wrist. And then we're going to have 3 that do something at the elbow joint. Okay, so let's just start at our fingers. We can see, here's the back of the hand. And let's just check out the tendons. So we have a bunch of tendons splitting from this muscle belly. So here's one, here's another, and another here. Okay, so all of those tendons are joining together at this muscle belly. And you can see that this muscle belly is actually going up to this condyle, which is the lateral epicondyle. So again, like how we had medial epicondyle common attachments, in the posterior antebrachium we're going to have a lateral epicondyle common attachment. So I'm going to put a star there so we can keep track of these. This muscle goes to the digits. It's kind of being hidden on this one, but there is one that's going to the pinky, and it goes all the way to the tips like this. Okay. Does not go to the thumb. This is called extensor digitorum. Because it extends the digits. You can also extend the wrist because it's crossing it, but extensor digitorum to all the digits. There's another digital extensor that goes to the pinky. You can see these two tendons going to the pinky. Here's the other one that kind of overlaps. And then tiny up here. And this would eventually get up to that lateral epicondyle kind of up here, I think. This is called extensor digiti minimi. So extensor of the little digit is how that translates. That's another lateral epicondyle muscle. Okay, and then finally we have a muscle that goes to the index finger. So right here, here's its tendon, kind of takes a crazy path. Wait, the muscle belly is over here. Come on. Some pink in there probably. And it kind of gets buried within there. Okay, this is called extensor. It's going to the index finger, so extensor indicis. Okay, cool. So there's our 3 finger movers. Now we're going to talk about the 3 thumb movers. So we find the thumb, we can see there's a tendon here to the thumb, and then here's 2 more here. So we're going to name these, color them in. 1 sec. Okay. So this first one that ends at the base of the metacarpal of the thumb, right here. So that's what we're looking at here. This muscle is called the abductor pollicis, and it's coming from that forearm, and there's one in the hand, so abductor pollicis longus. So that's the abductor pollicis longus. The next one we are going to talk about is this one. So this one is going to more of the back surface of the thumb, where if it pulls it would extend. So we call this the extensor pollicis. And this one is called brevis because there is one that's longer, and you can see the longer tendon right next to it, covering all the joints of the thumb. So this is the extensor pollicis longus. Kind of goes up here. So extensor pollicis longus. And these things are all in your book, and I'll have terrible handwriting, so you can follow along if you need to. For the thumb, we make what's called a brevis sandwich, just kind of a memory technique. You can see we have a longus, and then a brevis is sandwiched between them. This area here, created by these tendons, that's where the anatomical snuff box is. So the anatomical snuff box is created by those 3 thumb muscles. Okay, now let's go to the wrist. Okay, so these ones can be kind of tricky. There's a bunch of muscles up here, but let's just look at where the tendons are. So I see a tendon ending right here. This is crossing the wrist, and we're on the radial side. And this is the continuation of it. Okay. So it's on the wrist, it's on the back, it's on the radial side. We call this extensor carpi because of wrist, radialis longus. Extensor carpi radialis longus. If there's a longus, there's going to be a brevis, and the brevis is actually right next to it over here. Okay, so that's called the extensor carpi radialis brevis. I haven't really talked about the functions much because the name tells you what they do. And they're all innervated by the same nerve, so we're just kind of getting through the names here. That extensor carpi radialis brevis is going to the metacarpal of the middle finger. The metacarpal of the middle finger. So we like to say brevis goes to the bird. So if Mark was to probe this tendon, you would know that's the brevis because it's going to this metacarpal of that middle finger. Whereas the longus goes to the one where, like, if you do an L, longus goes to that index finger, so longus goes to the finger that makes the L. And then finally we have this one over on this side. It's crossing the wrist, and it's on the ulnar side, and there's only one of them. That's the extensor carpi ulnaris. Extensor carpi ulnaris. These are going to extend the wrist, and they will also do the radial deviation if it's a radialis, or ulnar deviation if it's the ulnaris muscle, kind of similar to the flexors. Then finally we get the 3 elbow ones. So let's see, do a red. Okay, we've got this little guy up here that crosses the elbow, and it's a little cone-shaped muscle. We call this the anconeus. It extends the elbow. Just like all these other things are extensors pretty much, this extends the elbow. The next one, let's see what color, dark blue. Next one we have is going to be actually start from way up here, and then we can't see it anymore. But it inserts onto the radial styloid process. So if you can remember what that is from lab, that's where this muscle is going to insert. And this is called the brachioradialis. And this is actually a flexor of the elbow, which is unique. It's a posterior antebrachial muscle, but it flexes. So that could be a test question. Brachioradialis flexes even though it's in the posterior compartment, which is kind of weird. And then the final one we can't see on this picture, but it's called the supinator, and it supinates. So there's all the muscles we need to know. So everything I didn't color, these muscles here, that was on this picture. That was these ones. And then the ones we didn't color over here, so this right here, that's the brachioradialis. And then we have the 2 radialis wrist flexors over here, or sorry, extensors. So those ones are what we're seeing over here. So that's kind of what we're seeing on those views. Hopefully that makes sense. So that's the best way I found to know these posterior brachials. You have 3 fingers, 3 thumbs, 3 wrists, and 3 elbows. And then you just kind of look at this picture. You can see the tendons, and you use your knowledge of how to name things and name them. Okay, to finish up with the muscles, we are going to end it with the hand. So, hand. Okay, we can separate this into a couple different categories. So, first one we're going to look at is our group of muscles called the thenar muscles. Then we have a group of muscles called the hypothenar. And then we have a couple other ones we'll discuss at the very end. So the word thenar just refers to the thumb side. Hypothenar refers to the pinky side. There's a mnemonic to help us walk through all of these muscles. So I'm just going to write that first. Sorry. Okay, this is the mnemonic for our thenar and our hypothenar muscles. Kind of stupid, but I think it's pretty helpful. So the ones that start with an A, the alls, these are going to be our abductors. So let's just start naming things. So we have an abductor, and we're on the thumb side, so we say pollicis. And then we had an abductor pollicis longus already, so this is the one we call the brevis. Abductor pollicis brevis. And I'm going to color that in, and then we're going to see how the pattern develops. So here we are at the hand. We're going to be looking at this view. This is the palmar, which is meaning you're looking at your palm, and this is the dorsal, meaning the back of your hand. So the abductor pollicis brevis is right here. And the name of the muscle tells you what it does. It abducts that thumb. Sorry, the lines are not super clear. So there's our abductor pollicis, and that's going to abduct the thumb. Okay, the next muscle we're going to talk about starts with an F. So I'm going to do that in green. F, if it starts with an F, it's going to be a flexor. And we're on the thenar side, so flexor, pollicis. And we had a longus, so we need a brevis. Flexor, pollicis, brevis. This is going to be a little bit more medial in that palmar surface. So there's your flexor, pollicis, brevis. Okay, and now we have a muscle that starts with an O. Anytime it starts with an O, it's going to be an oppositional muscle or an opponens muscle. So we call this the opponens pollicis, which just means that this is our opposable thumb muscle. It helps oppose our thumb. It's deep to that abductor and flexor, but we can see a little bit of it over here. And then we can't see any more of it. And if we're looking at this picture, it's kind of over here. But that would just basically pull this joint in to oppose our thumb to touch it with our pinky, which would reach down like that. So that's our opponens pollicis. And then our final thenar muscle is another A. But it's not an abductor this time. It's actually an adductor. So adductor pollicis. And there's no longus or brevis for this one. So these right here, those are our thenar 4. And to color that adductor, it's right here. Here's a little bit of it. Here's some more. Right there, a little bit there. That's going to adduct your thumb. Okay. Now we'll move to our hypothenar muscles, which means these ones are our hypothenar muscles. So again, if we have a muscle that starts with an O. We're going to have an opponens muscle. I'll do that in this purple. And now we're on the pinky side, so for pinky we say digiti minimi. So opponens, digiti minimi for little digit. Come up here, you can't see it very well on here, it's this little slip here. But you can see it's covered by two other muscles, so there's a pattern here. You have an abductor, a flexor, and then an opponens deep. We're going to see the same thing here, an abductor, a flexor, and opponens deep. And it's just pretty much a mirror image of itself. So now we have the F, which we know is going to be flexor. So flexor, digiti minimi. This one has a brevis. Even though there's not a longus in the body, this one has a brevis. And I do not know why, but just make sure you remember that detail. So remember, the flexor on this side was the green. So over here is where the flexor needs to be because the flexors are more medial in the palm. So there's our flexor, digiti minimi brevis. And then the last one we have, let's do this color. The red on the thumb side was the abductor pollicis brevis. This is the abductor digiti minimi. No brevis for this one. Okay. So there's that. And then the final one we have peanut butter. Peanut butter stands for palmaris brevis. Remember, we had a palmaris longus. We also have a palmaris brevis. And it's this right here. This one assists with grip in your hand. I can try and find a video of what it looks like when it flexes, but it attaches to this structure here, which is that palmar aponeurosis. That's the palmaris brevis, that orange. Okay, so there's your thenar and your hypothenar muscles, all for one and one for all peanut butter. And just remember, you have the abductor and the flexor, and then you have the opponens, which is under the abductor and flexor. So you have an abductor and then a flexor, and then the opponens is under it. And that's the same thing on the opposite side. So hopefully you can see it's pretty much just a mirror image. And then you just have to throw in the palmaris brevis and the adductor pollicis. Okay. Next muscles we're going to talk about, we call these the interosseous. Interosseous just means between bone. So the first ones are called lumbricals. These are on the thumb. These are on the side of the finger. They're on the sides of the fingers closest to the thumb. Oh, that doesn't make sense. They're on the thumb side of the fingers. Okay, they're on the thumb side of the digits, meaning if we're looking, here's the thumb, so that muscle has to be on the thumb side of these fingers here. So that's where the lumbricals will always be. So if you have to identify a finger, you're given a picture of a single finger, the lumbricals will be a good landmark to look for. So the lumbricals are always on that thumb side, and they come from in between the metacarpal bones. So here's all of our lumbricals. Then you can also kind of see them over here as well. Okay, so there's 4 lumbricals. 1, 2, 3, 4 lumbricals. Okay, and they're on the thumb side. So sometimes these will be called the thumbricals, to remember where they reside in the hand and what side of the fingers. The next ones we have are called the dorsal interossei. These are on the dorsal surface of the hand, and these abduct digits. And they're abducting away from the midline. Sometimes you will hear these called the dab muscles, because they're dorsal and they abduct. So the lumbricals were that. The dorsal interossei, you can see them really well on the back of the hand. So here's one. And as I'm coloring this, try and describe to yourself where these muscles are attaching on the finger, or how would you describe where these are attaching? Okay, so the dorsal interossei attach on the surface of the fingers away from the middle. So let me say that again. Here's the middle of the hand. The middle finger is the middle. And they want to abduct away from the middle. So each finger needs to have an abductor attached to it so it can abduct away from the middle. So we can see the middle finger has two. This one will cause it to shift this way. So this one will cause it to abduct that way. This one will cause it to go that way. So we're going away from the middle. Okay? And then this one will abduct this finger away. This one will pull that one away. Remember, the thumb and the pinky already had their own abductors that we talked about here. So they don't need a dorsal interossei. They have their own. So just remember, the dorsal interossei are on the side of the finger that is away from the center. And the center is the middle finger. And if you're in the middle, you can move away from the middle. Hopefully that makes sense. Next we have palmar or palmar interossei. These adduct the digits, meaning this is going to bring the digits in towards the midline. Sometimes you will hear these called the pad muscles because palmar adducts. So dabs and pads. These ones are going to be on the side of the finger towards the midline. So these are towards the midline. We can see them a little bit on this picture. Here's one here. The middle finger does not have any because the middle finger is already the midline, so it doesn't need any. These ones are a little bit harder to see exactly where they are. So side of finger towards the middle. These are on the side of the finger away from middle. Okay, so that's going to help you identify a finger, and we can walk through that so we can see what we're talking about. Let's talk about the innervation before we do that, though. So knowing all of those, there's two nerves that innervate all the muscles in the hand, the ulnar and the median. Remember, these innervated some muscles in the antebrachium. They continue down into the hand. So the median innervates the first and second lumbricals, which means your index finger and your middle finger lumbricals. It innervates the opponens pollicis. It innervates the abductor pollicis brevis, and it innervates the flexor pollicis brevis. This is what the half loaf is. If you've seen that in the book, the half loaf, that just stands for the first and second lumbricals. So first and second lumbricals, and then you have the opponens, the abductor, and then the flexor. So that's what the half loaf is referring to. The ulnar innervates everything else. So that means it's the palmaris brevis, abductor, digiti minimi, flexor, digiti minimi, brevis, adductor, pollicis, opponens, digiti minimi, and then it innervates your third and your fourth lumbricals. All of the dabs, or all of the dorsal interossei, and all of the pads, which are those palmar interossei. Interossei. So if you affect the ulnar nerve, you affect a lot of stuff in the hand and your finger movements. If you affect the median nerve, this is affected by carpal tunnel. So if you have this condition called carpal tunnel, it only affects these muscles. And we can talk more about that when we do brachial plexus. Okay, carpal tunnel only affects those muscles. So there's the innervation of the hand and the rest of those muscles. Let me get a picture of a finger. Okay, so here's the picture of the finger. We're looking at a dorsal view. The question would be something like, tell me what hand this is from and which finger it is. So I'm going to look at a couple things here. Just labeling things. Number one is extensor digitorum muscles, so I know I'm looking at the posterior view. Number two, that is what a dorsal interosseous muscle looks like. So number two is a dorsal interosseous. So I'm thinking to myself, the fingers that have that are the index, the middle, the ring finger. And I know it's always on the side away from the midline. Okay, so number three, this is called the extensor expansion, which we haven't talked about yet. We will. Okay, number four, so this is a tube-like muscle. And it's on that side of the hand. It's on that side of the finger, I mean. The tube-like muscles, this looks like an earthworm. The word lumbrical means worm-like, so that's a lumbrical. That's what a lumbrical is going to look like. They look like the tubes. And then we have number five. That is actually another dorsal interosseous muscle. So this has two dorsal interossei. I could have just looked at that very first instead of going through everything, but it has two dorsal interossei. And the only finger that has that is a middle finger, because it has two dorsal interossei, or two dabs. And then the lumbrical, number four, is always on the side towards the thumb. So the side of the finger towards the thumb. So just looking at my own hands, I know that has to be a right hand. That's a right middle finger. So key thing you should look at is see if you can find the dabs and the lumbrical. That will help you the most.